So Dr. Goel, isn't it a dilemma for a surgeon? Let's say a 60-year-old patient comes to you with knee problems. You know you can postpone the surgery by doing all these things for maybe 10 years. By the time the patient would be 70 years old, and maybe the other conditions will not be as good for the patient to go for a knee replacement. So what do you do in situations like this?
We need to be very clear that this joint replacement basically is a major surgery, not without risks, and we take calculated risks. The indications for surgery in my book, or as all literature suggests, or as the trainings in best centers, is pain and also when your quality of life is affected. See, your mobility is reduced, you cannot socialize. These are the indications for surgical intervention. Yes, if these are affected and you have to take drugs on a regular basis, then yes, you have surgery. Age is not a criteria now because the prostheses are very good quality, and obviously you can go for revision knee surgical procedures. Yes, if you wait longer, there are other risks that you will not be the fittest of bodies when you've had the surgery. But yes, the anesthetic conditions have improved. The anesthetics, you can give a spinal anesthesia, you can give blocks, and the surgical tools are like the surgery duration is reduced and the longitudinal implant is increased. We can definitely perform that.
So what I know is a good surgeon is one who knows not how to operate, not when to operate, but who knows when not to operate. So what are those conditions where you would not operate?
Yes, I think that's very aptly put. Yes, when not to operate, that's what we've always been taught. I would not operate when when there's active infection. B, I will not operate when the kidney functions have not been idealized. C, I will not operate when the patient is not well motivated. I would like to take the opportunity to liberty to put this example. We have lots of relatives coming in saying that they want an operation for the dad and mom because they feel that they are obliged to provide the best medical care to the relatives, and that too in India a lot of it happens. In that case, I tell them, no, I will not operate, but the outcome will not be as good. And also in the Indian setup, I do stress, I know we have these high flex knees, which you can use the Indian toilet seats. I would not recommend it. So yes, I do recommend that you modify the lifestyles and we idealize the conditions to increase the longevity of the prosthesis. And also, I'd also say when the circulation is not very good or the person's diabetes is not well controlled, I would not operate because it's a very high risk of infection, and once infection is disaster.
So what I understand, what I saw just outside your clinic, that AG Knee Clinic offers a 360-degree solution for the knee. It is not just a knee replacement surgical center. You take care of the knee in complete respects, from medication to the various lesser invasive alternatives like arthroscopy, and the final destination is when nothing else is working, it's a knee replacement. And there also you try to do, if it is possible, try to do a unicondylar or a partial knee replacement. So your respect for the natural knee is definitely something which is praiseworthy, because I met few other surgeons also, and there was this spine guy who said, you know, I'll never break a spine because as long as the natural spine is there, no artificial implant can match that.